On and on Diabolife towards life without diabetes. An invention in diabetes care. Let's understand diabetes in a nutshell. Diabetes mellitus or diabetes is a metabolic disorder of carbohydrate, fat and protein metabolism resulting from defects in insulin secretion, insulin action or both. Diabetes is a disorder of the pancreas which normally releases a substance called insulin into the blood, which helps the body to use sugars and fats that are broken down from the food we eat. Diabetes is not a disease, it is rather a disorder of metabolism. When a person has diabetes, the pancreas does not make insulin, makes insufficient insulin, makes insulin, but that insulin does not work properly. Diabetes has serious complications: heart disease, infections in the foot and leg, sexual dysfunction, Alzheimer's-like disease, stroke, gum disease, hearing impairment, nerve disease, slow healing, retinopathy, kidney and bladder failure, and complications in pregnancy. India is fast becoming a diabetic capital of the world with 62 million diabetics and is expected to cross 100 million by 2030. About 35% of the population is not even aware that they have diabetes. Why is it so? One of the core reasons in Asian Indian phenotype, where HbA1c count increases. Asian Indian phenotype adiposity is higher waist circumference despite lower BMI, body mass index. In Indians, insulin resistance is increased due to factors like greater abdominal adiposity, lower adiponectin, higher C-reactive protein levels. Let's understand HbA1c. When you test your sugar, you are looking at your blood sugar level at a particular point in time. Unlike your blood sugar level, your HbA1c measurement is performed by a healthcare professional and is a calculated average over a 2 to 3 months period. This is also known as A1c or glycated hemoglobin. A1c is hemoglobin that has been glycosylated or modified by the addition of glucose. When the body processes sugar, the sugar in the bloodstream naturally attaches to a protein in the red blood cells. Red blood cells have a lifespan of 8 to 12 weeks. Therefore, measuring HbA1c is a good way to reflect the average sugar levels over this time period. In a person without diabetes, the blood sugar levels are often consistent, meaning not much sugar attaches itself to the protein in the blood. The HbA1c is relatively low in people without diabetes because they have the ability to move the sugar out of the blood. But in case of diabetics, the body has difficulty in moving sugar out of the blood. So, the sugar remains in the blood. As the blood sugar level increases, more sugar attaches to the protein in the red blood cells and HbA1c is higher. This may increase your risk of developing diabetes-related complications. By reducing your HbA1c, you can reduce the risk of developing these complications. Therefore, it is recommended to have your HbA1c level checked every 3 months or as recommended by your doctor. Let's understand what happens in diabetes. When you eat food, carbohydrates are broken down in the stomach and digestive system into glucose, which is a type of sugar. We need glucose from food because that gives us energy. Carbohydrate-containing foods or things like starchy foods, sugary foods, milk, and some dairy products and fruit. This glucose then moves into the bloodstream and the body detects that the blood glucose level is rising. In response to that, the pancreas, which is the little gland which is just beneath the stomach, starts releasing a hormone called insulin. This insulin helps our body to get energy from the food we eat. The bloodstream then takes the glucose and the insulin to every cell in our body that needs it. To make this easier to understand, let's look at muscle cells. At the muscle cells, it is insulin that allows the glucose to enter the cells where it can be used as energy. It's a bit like insulin is a key for unlocking the door to the cell so that the glucose can get in. That way, the blood glucose level stops to drop. But the blood glucose level can be topped up at any point by the liver releasing extra glucose that it has stored. The blood glucose rises again, and again the pancreas produces more insulin to move with that glucose through the bloodstream in the muscle cells. Open the doors and let the glucose in. The body functions best when the blood glucose is at an optimum level. It does not work if the blood glucose level rises too high. Normally, there is a cycle within the body which balances out the glucose and the insulin level. And this is achieved by the food we eat, the pancreas, and the liver. However, in some people, the system does not work properly, and they develop diabetes. There are 3 types of diabetes: type 1, type 2, and GDM. In type 1 diabetes, the body isn't making any insulin at all. This is because of the autoimmune response, whereby the body has destroyed the insulin-producing cells in the pancreas. We don't entirely know why this happens with some people and not in others. Type 1 diabetes accounts for about 10% of all cases. It is most often found in people under 40s and is by far the most common type found in childhood. Type 2 diabetes accounts for about 90% of all cases of the population. It is most common in over 40s, in the white population, and over 25s in the South Asian population. Type 2 diabetes is a little more complex because it has slightly more process of work. Either the body produces not quite enough insulin, or the insulin produced is not working properly. That can be due to being overweight. Because of buildup of fat, it can stop insulin from doing its job properly. But it can also happen with people of healthy weight. So, in type 2 diabetes, the carbohydrate-containing food is broken down into glucose in the stomach and digestive system as normal. That glucose then moves into the bloodstream. The pancreas starts to produce insulin, which moves with the glucose through the bloodstream to all the body cells which need glucose for energy. However, the glucose can no way get into the cells because the locks of the door have become furred up with the fat deposit. That means the insulin can't open the cell doors properly. So, the level of glucose in the blood continues to rise. In response to this, the pancreas produces even more insulin. So the blood glucose level continues to rise and the insulin level continues to rise. This situation is further complicated by the cells which are desperate for energy, sending out emergency signals to the liver to release stored glucose. The blood glucose levels go up and up, and the pancreas produces more and more insulin until it can't cope anymore, and eventually it can wear out. Symptoms of type 2 diabetes come along very slowly, and some people don't have any symptoms at all. So for that reason, people can remain with type 2 diabetes up to 10 years before they realize that they have it. Gestational diabetes is a temporary condition that happens due to high levels of glucose during pregnancy of an otherwise non-diabetic woman. No specific reason is recorded, but we feel this is due to an increase in levels of placenta hormone that the mother and child get GDM. For people with diabetes, the glucose can't get into their body cells at all, so the level of glucose in the blood rises and rises. The body tries to lower the level of glucose, tries to get rid of glucose through the kidneys. That's why people with diabetes tend to go to the toilet a lot to pass urine. As the kidneys filter the glucose after the blood, they also take a lot of water with it. So the person with diabetes will get very thirsty. The urine contains a lot of glucose, and that creates an environment where it is quite easy for bacteria to thrive. So it is quite common to get thrush or genital itching. In the same way, the blood contains high levels of glucose as well. So, more bacteria than usual will tend to breed in fresh wounds, and it might be slow to heal. Glucose can also build up in the lens in front of the eye, causing the liquid in the lens to become cloudy. That can mean that some people with diabetes can have blurred vision. Because the glucose can't get into the cells to be used for energy, somebody who's got diabetes is going to start feeling very tired, lethargic, and unable to suit the normal day's daily routine. But the body still needs a source of energy to work properly. So what it does is it starts to break down fat stored, and that leads to weight loss. So the main symptoms of diabetes are frequent urination, thirst, thrush or genital itching, slow healing of wounds, blurred vision, tiredness, and weight loss. DibaLife is an invention in diabetes care. DibaLife is based on stabilized allicin from garlic. Garlic is known as a miracle herb. Garlic has been used since ancient times, and it is one of the earliest documented plants used for treatment and care. Garlic is also one of the oldest cultivated plants in the world, which has been grown for over 5,000 years. Garlic has been used since the beginning of civilization, right from the Egyptian pyramids to ancient temples. Interestingly, cultures and civilizations that never came in contact with one another believed and used garlic for treatment of diseases. Ancient medical texts from Egypt, Greece, Rome, China, and India each prescribed medical application for garlic. For thousands of years, people worldwide have been using raw garlic for health benefits. Benefits of garlic. Since the ancient age, garlic has been said to cure almost everything from common cold or flu to plague. Garlic helps to gain control over diabetes. Allicin in garlic is very good for controlling HbA1c levels, which is most important for diabetic control. It also helps in ensuring glucose tolerance in normal levels. Garlic is antibacterial, antiviral, and antifungal. Studies have proved that RBC in the blood process compounds from digested garlic and turns them into hydrogen sulfide, which relaxes blood vessels and increases the blood flow. But garlic has its own limitations. Raw garlic gets destroyed by stomach acid. It gets decomposed by intestinal epithelial cells inside the human body. It gets affected by body pH. It gives bad breath and bad odor. The solution is 100% stabilized allicin. Allicin is the major biological active component of garlic, which has a medicinal property. 100% stabilized allicin is the invention by European scientist Dr. Peter Josling. Using this 100% stabilized allicin, European scientists created a very unique formulation for diabetes care known as DiaboLife. DiaboLife towards life without diabetes. DiaboLife is for towards life without diabetes. DiaboLife is an Ayurvedic medicine. It is a natural dietary support for diabetics and wellness for everyone. One tiny 210 mg capsule gives the equivalent health benefits of eating 36 cloves of fresh raw garlic. DiaboLife is research-based and made of powerful herbal ingredients. It is made of 5 very powerful ingredients: 100% stabilized allicin, bitter melon, cinnamon, alpha-lipoic acid, and chromium picolinate. USPs of DiaboLife. DiaboLife is an invention in diabetes care. First time in India. Research-based and miracle product. Made with 100% stabilized allicin. Made of 100% vegetarian capsule. UK GRAS certified active ingredients used. Made with non-GMO ingredients. Patented formula. UK GMP certified active ingredients. Ingredients confirmed by EJNR. Active ingredients approved by MHRA. Product with documented clinical trials. Only product in the market, no competition. Present in various countries in the world. Complete, natural and herbal formulation with no side effects.
Well, DiaboLife is our first formula designed specifically for diabetes. There are a number of ingredients there, but the allicin obviously is the main ingredient, the main driver of benefit, and in terms of helping diabetics, that's type 1 and type 2 diabetics. The allicin is very good at controlling HbA1c levels. This is a measure of sugar bound to hemoglobin, and that's what is most important for diabetic control. But the other agents are also very, very beneficial for reducing insulin resistance and ensuring that glucose tolerance is in the normal levels. The idea behind DiaboLife is that people can prevent that from happening. The DiaboLife will allow them to absorb more nutrients and vitamins from the food they digest. It will reduce insulin resistance and therefore prevent this pre-diabetes condition.
DiaboLife is beneficial for everyone. DiaboLife helps to stabilize blood sugar levels. DiaboLife helps to control cholesterol. DiaboLife helps to boost immunity levels. DiaboLife helps to control blood pressure levels. DiaboLife is processed at the state-of-the-art R&D and manufacturing units. Diabolife. Towards life without diabetes.